All right, good afternoon, beautiful people. Another wonderful Thursday. I'm live at 1 o'clock on Wednesday to answer all the questions you've been posting. So, what's the first question of the day?
Okay, our first question is what's the process for out of town patients who wants to have surgery?
Well, we have a wonderful out of town patient program here. It's run by Chelsea. Patients start by doing a virtual consult with us, which means we use video, we use technology to its finest. So most of our patients use Skype, so we do the question and answer exam by video conferencing, and then you come to the office and we'll actually do a physical examination. You get your labs done, make sure you're healthy and a good candidate for the surgery, and then we'll give you this for surgery. And that's how that goes. We have a lot of patients come to Atlanta to see us from all over the world. Next question.
Alrighty. How many areas of lipo can be done at one time?
Excellent question. Safety first. So, depending on the amount of fat that you have, we can do about 4 or 5 areas. What is an area? Upper abdomen, lower abdomen, full waistline as 3 areas. Your upper back and your middle back is 2 additional areas, so 5 areas. That's usually what most people can handle. Sometimes we do thighs, so you can't do your whole thigh and your abdomen. That's too much. We what about fluid changes and things like that. So we limit. The first decision is your safety first, and then we go backwards. So we see what your body can handle, and we do that.
Okay. What are your requirements for diabetic patients who want to have surgery?
We have a lot of diabetic patients, and being a diabetic is not a contraindication to having plastic surgery. What we want you to do is to be healthy and make sure that your glucose is well controlled and your A1C is also within normal limit. So we require your medical doctor, your family medicine doctor, internal medicine doctor, or whoever is taking care of you to give you a medical clearance and tell us that you are taking your medication, whether it's insulin or metformin or whatever it is that you're taking, that is well controlled. So it's always good to give us a full disclosure. Most of our diabetic patients do very well because they tell us everything and everything is done right. So no problem.
Okay. What's the difference between a plastic surgeon and a cosmetic surgeon?
Excellent question. Well, I'm a full plastic surgeon, which means I did a residency in plastic and reconstructive surgery. A lot of patients don't know this, but anybody, any doctor in this country can do cosmetic surgery, and it's legal whether they have training or not. Like you have an emergency medicine doctor or internal medicine doctor, or even a radiologist can do your liposuction. They may not know the anatomy or have the adequate training, so they can do. So those are the cosmetic surgeons. They have not trained in plastic and reconstructive surgery. Plastic surgery is a combination of reconstructive and cosmetic surgery. So I'm trained in both. So a plastic surgeon is someone who's first of all a surgeon that's trained in plastic surgery. And a cosmetic surgeon could be any doctor that do not have training in plastic and reconstructive surgery. So that's the difference.
Okay. How long after surgery can you proceed with your second surgery?
It depends on what your first surgery is, but most of our patients wait a minimum of 6 weeks. Some wait 3 months, so minimum is 6 weeks.
What are
Next.
some non invasive ways you can get rid of dark circles?
Dark circles, that's a tough one. So there's so many reasons why you have dark circles. So it could be hormonal, genetic, all kinds of stuff. So we really need to see you for that. There's so many options that we use for that kind of stuff. So that's a tough one because I have to see you and examine you and see what works. Because sometimes you may have even like fat bulges or stuff like that. That's a very broad question, but I would like to see this patient and do a good consultation. It's a tough problem though.
Okay. What's the difference between a mini lift and a full facelift?
Okay, so recently many people are doing all kinds of non-invasive stuff to rejuvenate the face. So a full facelift is becoming rare and rare right now. So most of us now do a mini facelift basically without doing all the full facial reconstructive procedures. So most of our patients do a mini facelift, and we can do that awake without going to sleep. Basically, we tighten the facial, what's called fascia or muscle, and then we re-drape the skin, do a little liposuction, and do anything else that you need on your skin. A full facelift involves more than that, and the recovery is longer.
Okay, last question. What is a VI pill?
VIP is a chemical pill that we offer here in our practice and in our medical spa, Amachi Med Spa. It has a combination of all the most common chemical pills, and it's a 1 week pill basically. After one week, you'll be very vibrant. It's the most common chemical pill that we offer.
Okay.
That's it. That's all the questions.
That's all.
Well, if you have any more questions, we have our website is awesome, georgiaplastic.com. We have a lot of information there for you to learn. If you are interested in the non-surgical stuff that we offer to our medical spa, it's amachimedspa.com. Thank you. I'll look forward to talking to you guys next week.